Hi everyone, welcome to week 4. This week we are talking about effects of change and customer service. Now, before we dive into course content for this week, your assignment should now be posted on Canvas. If you do not see it, please let me know ASAP and I will look into it, make sure that nothing weird is going on the tech side of it. Other than that, if you have any questions about it, I would point you back to last week's lecture. At the very beginning, we went through the assignment and just kind of covered the meat and potatoes of it. If you still have questions after re-listening to that, please send me a message via Canvas and we can sort out any of the issues going on. And as a friendly reminder, better do that sooner rather than later.
Now, first up, the thing that we're going to talk about, we're going to look at the effect of change in a healthcare setting. Before we can make any sort of change and then evaluate that change within the healthcare setting that we're working in, we have to ask and come up with robust answers to a couple questions, right? First and foremost, we have to figure out what are we trying to accomplish? What's the end goal of what we're trying to do? Then we have to investigate as to how do we know whether the change that we're proposing is indeed going to lead to an improvement in that end goal. We also have to ask ourselves, what are the changes that will result in expected improvement, right? So we know what we want to accomplish. We know where we're currently sitting. And so we have to develop kind of a plan to enact some sort of change so that we alter the status quo in the setting, right? Think of it in terms of when you answer these questions. Think of it in terms of when you get an essay assignment at school, right? You're asked to develop an idea, right? That's going to be the change that you want to enact. And you're going to get that from looking at what you're trying to accomplish and the expected areas of improvement that you've identified. You're then going to basically go to bat for that idea or that change, right? The easiest way to do this is to take a look into the literature to see what's been done previously, right? You can ask yourself a whole bunch of questions in regards to best practice guidelines and such. But the best way to go about it, conduct a brief literature review, see what other people have done, get kind of their theories of change behind how they made their improvements, and then piece it all together in kind of your own form of essay, right? And then in that way, you're going to strengthen your arguments for developing change when you propose it to a team. Let's take a deeper look at answering what are we trying to accomplish. Now, to answer this question, we have to be as specific as possible about at least 3 domains, okay? We have to be specific about time, the affected population, and the measurements, okay? But with that being said, we can't forget about the whole SMART goal setting principles, right? So while we're still tackling some of those, answering these 3 specific areas, we want to make sure that we're still pointing back to SMART goal setting. So the first thing we have to look at is time. What is the time frame that we have to accomplish whatever it is we're setting out to accomplish, right? We should be as specific as possible about this so that we can develop feasible plans to accomplish our goals in that time frame. We have to think about the affected population, right? Who is it that we're gearing these changes and our goals towards? Are we looking at improving something in the realm of patients? Maybe it's clients or staff. Depending who you're targeting may change the planning that is undertaken. The third piece is measurement. So how are we going to measure what we're trying to accomplish and what are we going to do with that data? So this is more of the research end of things, right? So what key indicators can we even measure to figure out if our change is an improvement or not? And what are we going to do with that data once we have it, right? Are we just going to look at it in terms of descriptive stats? Are we going to just take base levels in the sense of statistics and do surface level statistical analysis? Or are we going to dive into the weeds and look at regression models, so on and so forth? Okay, so these 3 things, the bare minimum for answering specifically when we are answering the question, what are we trying to accomplish? While the previous slide talked about things that we have to look at in detail, There are other things that we have to keep in mind when we're looking at the pending improvement we want to make, right? We have to kind of figure out the domain that we're heading in. We have to figure out if we're trying to make something safer, right? So to avoid injury to the group in which you're trying to assist, right? That affected population. Are we trying to accomplish something in terms of effectiveness? So care matches best evidence that's employed right now. So again, diving into the literature, we want to avoid redundancy and overuse, right? So anything that's repetitive. Are we looking at things in this pending improvement in the sense of patient-centered? So is there respect of persons? Does it maintain dignity, etc.? Next, is it timely? Are we looking to reduce waiting times or diagnostic times? Maybe time to treatment or time to effect in terms of interventions? Again, this is something to keep in mind, but it also directly correlates to that time piece that we want to be very specific about from the previous slide. Next, is the pending improvement efficient? Are we reducing waste and excess processes? Now, this can match with effectiveness in the sense of avoiding redundancy and overuse. If you're repeating steps, it's generally thought of as a wasteful process. So we want to keep that in mind when we're designing a pending improvement. And then lastly, is it equitable, right? We want to try and close racial and ethnic gaps in health status or access to care, okay? So these 6 domains are something we want to keep in mind when we're trying to develop our pending improvement and deciding on what we're trying to accomplish. The next question that we have to look towards answering is, how do we know whether the change is an improvement? To answer this question, we have to rely both on measurements and the data that is generated from those measurements, okay? Now, to quantify change, we have to be able to measure and track it in a quantitative manner, right? This will allow us to look at both the trends over time and then to generate a report of the results. Now, ideally, what we want to see is we want to see over time that measurement either increase or decrease, which corresponds to kind of the goal of the change improvement. This also brings a challenge to it, however. That challenge is making sure that we're taking the correct measurements, because taking the wrong measurement can lead to illusionary improvements. For example, if I'm looking at the number of falls of a resident in long-term care, but I'm only taking into account the number of hospital visits residents have outgoing for maybe acute injuries, I do not have the right measurement. I might be on the right track, right? Because in my mind, what I'm thinking is, well, maybe I'm only wanting to capture the falls that lead to a potential injury, right? Potential being the key word here. So in my mind, when a resident falls and gets injured, or it's a suspected injury, we're going to send them out in hospital. However, I want to capture all the falls. So if I see the number of hospital visits tend to decrease, that might not be correlated with the number of falls going on in my home, right? There could be a number of reasons that those residents are not going out to hospital after a fall. So I would actually be having an illusionary opinion on the effectiveness of the improvements I have into place, right? We have to keep in mind that there is a difference between research measurement and quality measurement. Research measurement typically is looking to generate new data and to test hypotheses, whereas quality measurement is looking at effectiveness and efficiency. Now we move on to what changes will result in expected improvement. Now, one thing to note right away, not all changes will lead to improvements, at least in regard to our objectives. Now, I'll go on a bit of a tangent and say if you're a Maple Leafs fan, Toronto Maple Leafs, you know this all too well, right? And it's the same sort of thing when we look at quality improvement. How many times has your favorite sport team thought, okay, we're doing poorly, so let's change the head coach? They make a change in the roster, right? They change the staff, they change the head coach, they might trade some players. They're making an improvement change. Now, especially in the case of Toronto Maple Leafs, what do we see the next year? We see the same result, right? We see a round one playoff elimination. In this manner, change doesn't always lead to the intended improvements. Now, to avoid this, particularly coming back to our healthcare perspective instead of athletics, the improvement must be expected before the change is made. So the best way that we can do this is going through a PDSA cycle. So plan, do, study, act. And we're going to talk about this in a second. Now, we can also talk about change concepts. So a change concept is a general approach used to develop specific ideas of change that lead to improvements. These can be combined with knowledge to generate ideas for tests of change. Now, the important thing to think about when we're talking about change and change concepts is that typically change isn't just kind of a random fleeting thought that you invent. When you look at implementing a change, you want to go into the literature. You want to look at evidence-based care and dive deep into that literature and have something that's backed by research, okay? Now, once change ideas are formed, they can be run in small groups, something called pilot testing, and then it can be expanded to a larger group if effective. And the reason we do this is because if we don't know that a change is going to work out as intended, we don't want to waste resources, both time and money, but we also don't want negative effects to be widespread. Okay, if our change completely backfires, right? If we use our Maple Leaf example, if we change the head coach and then we don't even make playoffs, that's not good. So what we're going to do is we're going to pilot test our change. We're going to take a small group, make the change in that group, see how it resonates with the staff, see what the outcome is. And if that outcome is positive and the staff are well receiving, then we're going to spread it to maybe an entire, in the healthcare context, maybe we extend it to an entire floor. And then if it works well there, then we can extend it to an entire facility. Okay, but we don't just want to theorize a change, make a plan, and then widespread implement it because of the potential for negative effects, especially if it's a novel approach. Okay, so we mentioned it previously in another slide. Let's take a look at the PDSA cycle. So plan, do, study, act. To be completely honest, it's exactly what it sounds like. So in the plan phase, so we're planning a test or an observation, and we're going to do this including the data collection methodology, right? So we're basically, in essence, planning something similar to a research study, right? We're stating the objective, what we're setting out to try and do. We're making hypotheses based on these objectives and the change we're planning to implement. We're developing the plan, the overall plan for testing that change, right? So the 5 W's, and then we're documenting 1 through 3. So we're actually writing it down in sort of an informal report. So you can think about this as kind of like if you're looking at a research paper, it's everything from the background to the methodology piece, right? The data analysis and everything. Now, the do part, so we're pilot testing the change. We're performing the test, we're documenting the challenges and the problems that arise, and then we're going to start our analyses, okay? The study portion of it is where we're actually analyzing the data and we start interpreting the results, okay? So we need to complete the analysis of the data. We're going to then compare the data and then go back to our plan phase and compare it with our hypotheses that we made. We're going to summarize everything that happened, and then we're going to reflect on everything from the plan to the study phase. The act kind of part of the cycle, the last phase of it, we're going to make changes based on that pilot testing, okay? So we're going to look at our reflections and our summaries. We're going to determine the modifications that we need to move forward, and then we're going to prepare to do this all over again, okay, if needed. Sometimes it won't be needed. We got the exact results we intended to get, and we can implement that change. Other times we have to make modifications and then go right back to the plan phase of the cycle. Now, there are some areas or items of concern when we're talking about improvement projects. So while these aren't necessarily easy areas to target quality improvement or performance improvement plans and projects, they are key focused areas we really want to concentrate in on. Okay. Now, the first one is eliminating waste. We want to eliminate all that does not add value to the project or process at hand. Now, this is going to link with the second one we're going to talk about, but in a material sense, think of it in this way. And this kind of just popped into my mind. This was something that, I was sitting with my 2-year-old and we were cutting shapes out of Bristol board, right? Now, if I just gave her the Bristol board and said, cut shapes, do whatever you want, she's going to cut shapes, and she's 2. She doesn't have a plan. She just cuts the shapes out and, she gets a circle or a square and she's happy. Now, from kind of a parent perspective, I see all the wasted paper because she's been cutting shapes all without a plan. And now I have a huge proportion of the poster board that's just sitting on the ground that's unusable. Now, if I was to do the same thing and I want to eliminate waste, I'm going to plan it out so those shapes they sit nicely on the paper, and there's not a lot of Bristol board left over once I'm done the task of cutting out all these shapes. That's kind of a toddler version of eliminating waste, okay? Planning out how we kind of cut shapes out of the materials we have so that we make best use of them. The next one is improved workflow. So similar to eliminating waste, we want to streamline workflow by eliminating all the unnecessary processes to improve time efficiency, okay? Not just time efficiency, but this is also going to reduce error. Now, think of this in terms of if I'm solving a math equation, okay, and that math equation has 10 steps, that's 10 areas in which I can make a mistake, right, with my arithmetic. And humans just naturally make mistakes. Now, if I can solve that same math problem in 5 steps, I have half the likelihood of making a mistake. Now, that's not saying we should skip steps because it eliminates errors. If we skip necessary steps, it actually introduces an increased likelihood of errors. But what we want to do is if there's a repetitive step, right, it's not really adding much to the workflow process. What we're doing is we're adding extra time that we really don't need to add and introducing potential error. So we want to eliminate all repetitive steps. The next thing we want to do is we want to optimize efficiency or inventory, right? Inventory is a primary source of waste, and it may be a good place to start when we're looking to eliminate waste and improve items within the organization. So if you've ever worked in kind of the food industry, you know this very well, right? You get food product in and it has a best before date. So we want to actually be rotating our products. So the ones with the sooner best before date are at kind of the front of the supply storage, right? In this way, we use up stuff before it expires and it doesn't go to waste. If this is done improperly, you get items that get buried in the back of kind of the storage unit, and eventually you find it and that product is no longer usable because the best before date or the expiry date has surpassed, right? And this can often happen, right? Especially in healthcare where things like medications and certain PPE products, so on and so forth, have expiry dates that we need to use them by. Next up, we have that changing the work environment. So looking at the environment in which work is taking place and seeing what changes we can implement to make the workplace more efficient, whether in terms of time, resources, or output, okay? Now, a good example of changing the work environment, so there's a show called Brooklyn Nine-Nine. It's a comedy sitcom that looks at the lives of New York City police detectives. In this one particular episode, what they're trying to do is in summary, they're trying to maximize the efficiency of the detectives while they're sitting kind of in the bullpen, right? So the police chief and one of his detectives looks out into the environment and they start manipulating the environment to try to stop certain detectives from interacting with one another because they're spending too much time talking, or trying to keep people away from, say, like the kitchen because they spend too much time eating. Now, keep in mind, this is it's dramatized. So it's not like we're going to move someone away from kind of the desk close to the kitchen to one that's far away from the kitchen so that they don't eat instead of working, right? We're not going to do that. But it's just kind of like a comedic view of how we can affect the work environment to make things more efficient. We also have changes that we can make to the producer and or customer interface. So these interface changes allow for producers and customers to recognize newly implemented improvements. We also have managing time. So in essence, we want to reduce time to create and develop products. We want to reduce wait times for services or treatments, or we want to reduce the cycle time for functions that can eventually lead to competitive advantages within the organization. Okay, so think of it in terms of if we put kind of our lens on in terms of Ontario healthcare system right now, there are a lot of initiatives going into reducing wait times for surgeries, right? So much so that the government has now looked towards private surgical centers to start doing surgeries that are offered in public settings to reduce that wait time. Okay, so there are other ways we can reduce wait times for these services, and that's where kind of your job would come in, looking at things like that. We also have a focus on variation. So now I want you to go back to number 2, where we were looking at workflow, and focus on variation. Remember, we want to reduce variation to limit errors, right? We want to assist in the predictability of results and limit poor results, essentially making poor results an outlier. So if we add in a lot of variation into a process, again, it's kind of like adding steps in the mathematical equation. We're introducing the potentiality of an error. This then leads into number 8, which is error proofing. So we want to focus on limiting the possibility of human-made errors, okay? One way we can do this is by altering the environment. Again, going back to a previous step, where in this example, we make 2 buttons with 2 different functions look drastically different, rather than making them both, let's say, circular buttons, the same color with just the printed words stop and go on them, right? That's going to be very confusing to an operator who has to basically act very quickly. We want to make these things very unique so that it avoids confusion. We can also add manuals and guides that help employees. They can refer to manuals and guides rather than relying on their memory to perform a function. We then have a focus on the product or service, right? The focus does not need to be only on the process. Improvement can be made to the actual service or product itself, okay? So in terms of like, let's use that surgical example. Yes, we want to reduce wait times. We want to improve the process, but we can also have an overall improvement if we improve the product itself. For example, we can limit the number of knee replacements that need to happen by making a sturdier or a longer lasting knee replacement itself, right? Think about how many people have knee replacements that have to come in to get the knee replacement renewed, right? It does happen. Same with hip replacements. If we can create a superior product that's going to last longer, we then can perform less surgeries in terms of having to replace some product that has gone bad, okay? Let's now shift our focus away from effects of change and change improvement to customer satisfaction. Now, essentially, the customer, for our purposes, is the person or unit receiving the output of a process of the system, okay? So customers typically thought of someone coming into the shop, they're there to buy something and to receive a product. However, this definition can be expanded so that it's basically the receiver of the output, in the sense of it could be a nurse working at the facility that we're working at, right? It could be the surgeon performing a surgery, right? So it's not limited to the patient or the client, right? Or the customer in the sense of a traditional definition. It can be the staff as well as stakeholders as well. Now, customer satisfaction can be difficult to define because it is a highly personal perception of something, right? My satisfaction with a product is going to be different than someone else's satisfaction with a product, right? And it's going to depend on the use of that product, right? Many products have multiple uses. I might look at something, say like a keyboard, and really value a traditional looking keyboard, right? Something that I've come to learn on, something that I've come to be able to predict where all the keys are, whereas someone else might like kind of the ergonomic keyboards, right? There's a different layout. It's kind of, it's more widespread. Maybe in certain keyboards, the letters will be arranged differently, right? Whereas someone else might be very receptive to that, I am going to be very traditional and unreceptive to that. My satisfaction is not going to be met with something like an ergonomic keyboard, right? Now, we then can apply this in terms of healthcare setting, right? There are some patients who like doctors who have very good bedside manners, right? Patients are willing to forego maybe the most knowledgeable doctor for a doctor who has more person skills, right? The bedside manner side of things. Whereas there are other people who say, I don't really care what a doctor's personality is or how they interact with me, as long as they do their job to the best of the ability and they are highly competent, right? They could basically recite literature through a photographic memory, okay? People have different tastes. Now, this may involve, in terms of customer satisfaction, time to receiving a service or a treatment, quality of that service, friendliness and professionalism of staff, and performance of staff. Okay, and like we talked about, people appreciate these in different quantities, right? Not everyone is going to have the same appreciation for something. Some people might want to receive a service very quickly, whereas others will be willing to wait as long as the quality of that service is up and beyond kind of a standard guideline. Okay, so it is very personal. So what is service quality? So service quality is the extent of discrepancy between customers' expectations and desires and their perceptions of the service itself. So customer satisfaction is meeting the perception of the customer with their expectations. Okay? And there's 10 dimensions of service quality. There's tangibles, there's reliability, responsiveness, competence, courtesy, credibility, security, access, communication, and then understanding the customers themselves. Okay, so we want to hit on these 10 dimensions of our service quality to yield proper customer satisfaction. Now, above and beyond all else, the number one principle in customer satisfaction is to know thy customer. What this means is know who you're developing the product for, what they expect of that product, and then deliver on those expectations. Now, there are several factors that will assist with customer satisfaction. The first, and again, the most important, is identify how the customer is defined, otherwise known as know thy customer. Know who you're designing for, sorry. The next is understanding the levels of customer expectations regarding quality. What is it that the customer is expecting you to put forth? Okay. Now, if you ask someone what they expect in an iPhone, they have very rigid expectations for what the next generation of iPhone is going to be. They expect something of better quality. If Apple does not deliver on that quality and it does not meet customer expectations, the customer satisfaction is going to be quite low for that product, right? Understand the strategy of customer service quality. Okay, how are you going to meet the customer's expectation for quality? Then understand the measurement and feedback cycles of customer satisfaction. Okay, understanding how we're going to collect customer satisfaction, how we're going to get the feedback, and how we're going to implement kind of that quality piece so that we can then meet customer satisfaction targets, right? So we do want to measure how a customer feels about the product or process initially. We want to make our changes and then have measurement and feedback cycles, right? Think about the PDSA cycle as well and how it implements and is associated with this. We do have levels to customer satisfaction, okay? For example, we have at the very base, we have level 1 customer satisfaction. It's simple and assumptive expectations. These are basically like the bare minimum, okay? So when we get on an airplane, the bare minimum we expect from an airplane is that it takes off safely, right? It actually does what it's meant to do. The next level, level 2, is the expectations now require some form of satisfaction through specification, i.e. being treated with courtesy, okay? Level 3 is kind of the higher end level of customer satisfaction. It's much higher than levels 1 or 2. It requires a delightfulness or a service so good that it attracts customers to it. So this is kind of that mantra of going above and beyond. Now let's apply this to kind of the iPhone example we talked about earlier. When iPhone first came around, you have level 1 customer satisfaction. Basically, does the iPhone make calls, right? Maybe depending on when it was implemented, can I text my friends with the iPhone, right? Pretty straightforward. Level 2, expectations, right? We're now requiring some form of satisfaction through the specification. So the next generation of iPhone, oh, now I can access the internet through my iPhone. Now I have data capabilities through my iPhone. It can now take pictures, right? Then we have level 3 with that much higher level of expectation, right? So can the iPhone now anticipate my needs before I even know I need something, right? Think about using like the Alexa, like the Echoes and stuff like that. I'll be sitting here and my Alexa will kind of beep and say, hey, it's time for you to order oats based on your previous consumptions, right? So my Alexa robot is meeting my needs. I have satisfaction for this product because it's essentially ordering my oats for my oatmeal in the morning before I've run out of oats in my house, right? It's going above and beyond the call. I now don't even have to order oats manually, okay? That is kind of the level 3 customer satisfaction. Now the problem with that is now I expect that the next generation of product will do that and more, right? Because customer satisfaction is meeting the customer expectations. So it's always kind of raising the bar as you put out a new product, which I should mention kind of as a fleeting thought, that also shows the need for continuous quality and performance improvement, right? If I set the bar and then I supersede that bar, the bar is set even higher the next time around. Now we can summarize the attributes we need for successful customer service and then thus satisfaction through the use comfort, right? So if we demonstrate caring, if we're observant of the customer, if we're mindful of the customer and their expectations, if we're friendly towards the customer, if we're obliging, we're responsible, and we're tactful, we will have good customer service and thus yield high customer satisfaction. Okay, so this is what we want from our team, our employees, and even really those that are putting forth the service that we're trying to give to customers. If we can demonstrate these things, we will have successful customer service. Now, when we approach healthcare service through a quality improvement lens, we really service quality improvement through a 3-pronged approach. So we're going to tackle things first through a cost lens, right? We want to reduce costs in terms of quality improvement. We then look at time to implementation, and then we look at patient service impact, right? So we want to really increase the impact of our services. We want to reduce time to implementation, and we want to reduce costs. Another thing that we want to be talking about is employee empowerment. We want to empower our employees in order to really put forth the best services that we can, okay? And this is one of the most important aspects of patient customer satisfaction, okay? The empowerment of our employees leads to optimization in patient experience. Okay, and this is also outside of just kind of the medical procedure. Okay, so going back to talking about bedside manner, right? A doctor with good bedside manner will improve customer or patient satisfaction, right? Regardless of how well the procedure went, it is always improved by a doctor or a nurse with improved bedside manner. That is one component. Those professionals will have better bedside manner if they feel empowered to do so. Okay, so when we look at kind of our quality or performance improvement initiatives, we want to be focused on employee empowerment. So I hope by now that you've noticed that performance and quality improvement is a complicated process. There are a lot of moving parts. It's also important to understand that we're not going to be successful in implementation in all of these moving parts in one go. It often takes many cycles to target each aspect. So don't feel disheartened if you put in a quality improvement initiative and you've missed one of these pieces in the very complex pie. Okay, it often takes many iterations to get everything right. Now, one model we're going to focus on when we're talking about patient or customer satisfaction is the 6 P's and S model. So this model demonstrates what the patient recognizes as the minimum interaction which leads to satisfaction. So this should be the minimum kind of principles or things that you touch on when interacting with a patient in a healthcare setting, okay? So it should be noted that even with utilization of this model, in order to sustain excellence, those working in healthcare must foster a culture of excellence through commitment and teamwork. Healthcare is one of those domains where you don't simply just show up for the paycheck. You need to foster a culture of excellence within your facility, okay? So we have to be empowering our employees to be seeking to do the best job possible at all times, okay? Now, the 6 P's and S model includes safety for S. So all patients should be assured and expect that their safety is placed as top priority, right? When we go into a hospital, we want to know that we're coming out in, at a bare minimum, the same, if not better condition that we entered the hospital. To achieve this, staff will check the 6 P's, which we'll talk about in a second, in all rounds and interactions with that patient, and concluding with staff informing the patient when they can see them next, okay? There is nothing worse as a patient of a nurse or a health professional leaving the room and you have no idea when you're going to see them again. At least if you inform a patient when they will see you again, they can then know, okay, well, you know what, maybe I need something in the near future, but it can wait. I know I can wait until I see that nurse at the top of the hour because that's when she said she's coming in or he said they're coming back in, okay? The next thing to address is pain. What level of pain or discomfort is being felt by the patient, okay? By asking the patient this and letting them know they've been heard, it empowers the patient and makes them feel like they've been heard, but it also gives you, or the staff, I should say, the opportunity to address the pain and discomfort. It might be just reassuring that patient that, yes, we're aware of your pain or discomfort. It's expected that you would feel this way, or 1 second, let me go get something to help you with that. The next is personal needs. Are there personal needs that require attending, such as toileting, a change of clothes, or anything related to comfort, right? This might be even bed position, so on and so forth. The next is pulmonary hygiene. So this isn't going to necessarily be something that the healthcare professional asks the patient, but they could be assessing and performing exercises for. So performance of breathing exercises with the patient, just to make sure that they're in a good state of health. Next is position. So we want that healthcare professional to help the patient reposition for comfort and also to avoid complications such as bed sores, okay? And this is something that happens often in like long-term care facilities. If this isn't done, residents can develop bed sores, which leads to poor health and poor satisfaction of the resident, okay? At this time, that health professional should also be doing a skin inspection. Next is possessions. So ensuring that everything that the patient or customer needs is within their reach. In long-term care or even a hospital setting, this has implications to things, key indicators such as falls risks, right? One of the ways that we reduced falls in the facility I worked at was simply taking everything that resident verbalized that they needed and bringing it within reach, right? So that the residents who needed the aid of a walker or a cane, they're not getting up without that walker or cane to get, say their glass of water that's on the other side of the room. And the last one is place, ensuring the environment is clean and safe, and there's no clutter that's going to contribute to a fall or a trip, okay? Now, I understand that this is very much more applicable to like a nursing setting, but as quality and performance managers, you have to be aware of what's expected of those healthcare professionals, right? If they are failing in one of these, I'll call them opportunities. If they're failing in one of these opportunities, your customer satisfaction will be subpar to where it should be, okay? It is your job to understand that this needs to be implemented, and it's your job to make sure that they are doing these things. As we talked about with the effects of change portion of this lecture, we need to develop a way to measure patient satisfaction, okay? Now, the easiest way of measuring satisfaction is through the use of a questionnaire. And I am sure everyone listening to this has been offered the opportunity to fill out some form or questionnaire. Even the course feedback surveys that you guys do at the end of a semester, that's a way of asking, in essence, customer satisfaction, right? You being the customer, you're on the receiving end of a product, your education, and then you're being asked your satisfaction with what you received, okay? Now, we have different components that we can tackle, and in no particular order, we'll go through them, all right? Because one thing to also understand is this is a cyclical process, right? Of course, you have to start with the development of the tool itself and understanding what you're going to use. But once it is implemented, it is a circular process to make sure that every customer going through the process or procedure or receiving the product is satisfied with it, okay? So the first we'll talk about is effective survey design, okay? So this is a complex task. We have to identify the audience that we're sampling. We need to understand proper data collection, analysis, and design methodology. And this is just something that's very important and instrumental right at the base outset of developing the tool itself, okay? To do this, we have to understand the people that will answer the survey and understand, or I should say, make them understand the benefit to them, okay? So hopefully you've heard when you've been asked to do course evaluations that it is to benefit students, right? It's to benefit future students. It's also to benefit you. I'm going to say minus if you're in fourth year, because if you give good insight into what you appreciate in a course, the professors also talk amongst themselves in order to improve their own courses. So a course feedback form that you fill out for one particular course could actually have an effect on a future course that you partake, right? I'll talk to my colleagues and I'll say, okay, what did the students say that they needed to get more out of a course, right? I can then take that and I can implement it. We then have auditing and evaluation. So you should complete at least one annually, right? You should complete patient satisfaction at least once a year, right? Realistically, you want to be doing this more than one a year. Next, we have results equal action, okay? So regardless of the results, there's something that can come out of it. If it's bad news from the results, you can enter an improvement cycle focused on getting better results and better satisfying your customers. If you get good news, that's encouraging, right? That's positive feedback that you know you're doing something right, and you can go into the next implementation cycle kind of invigorated, okay? And then we have the quality aspect. So the information gained from the questionnaire is only as good as the quality questions asked, okay? If I notice that I'm not getting the information I need from the questionnaire, I'm going to have to change the tool. I'm going to have to change the quality of the question asked, okay? So even in the development of the patient satisfaction instrument itself, there's going to be improvement processes within that as well. Now we're going to focus in on creating the actual questionnaire tool itself. So essentially, whenever possible, we want to use an already validated and reliable tool. So we don't want to get caught up pilot testing the questionnaire that we're going to use. We want this to already have been done for us. So we're going to look to the literature to see if there's anything that aligns with our needs. Next, if we are designing the questions, we need to keep in mind the difference between open-ended versus closed questioning. Open-ended questioning is going to give you a little bit more depth to the answer that's given to you by the customer or the patient, whereas closed questions are going to provide you with that utility to perform quick and easily identifiable data. If you're developing a survey or a questionnaire tool from scratch, keep in mind, as mentioned earlier, that you have to pilot test it before implementing it for validity and reliability. Now, this will add rigor and trust to your findings. So that being said, it's not that it's a necessary step out in practice. However, it does add rigor and trust to the findings that you're going to present to stakeholders. And when you get to the quality improvement process, you're a little bit more justified in what you're proposing. Now, it's also essential to liaise with stakeholders when developing your questionnaire, and this just ensures that the questions that you're asking within the questionnaire are actually applicable. There's nothing worse than creating a questionnaire to roll it out just to realize that you're collecting all the wrong kind of data. Lastly, it's really important to understand that the questionnaire design, it's quite a complex topic, right? There's a lot of things that go into it, everything from the questions that you're asking, the order of the questions and how they're presented to the patient or the customer, the length of the questionnaire, the tone of the answers that you present if you're using closed-ended questions, and the comprehension of the patient or customer to understand what you're asking in your questionnaire can all influence the design, and this can be quite a lengthy process. Okay, so just a couple concepts to keep in mind as we sign off here. So keep in mind the purpose. So while satisfaction is important, you have to balance satisfaction with the performance of your output or your product. Okay, so you can have full customer satisfaction, but you can have a subpar product or output. And so we need to really balance this satisfaction piece with the output in the product, right? We don't want to rush something too much for substandard results. The next thing in terms of the questionnaire is ensuring you're getting the right data. The questionnaire is only as good as the data you collect, right? So you have to ensure that you're collecting actionable data. Is the data you're collecting actually usable? If you're collecting open-ended data to do statistical analysis, I can tell you right now you're collecting the wrong data. So make sure you understand what you're collecting and how you're going to use it. Next, we have to remember to be concise. We want to keep both the questionnaire and the report concise to ensure usability, right? In terms of the questionnaire, people don't want to answer something that's going to take them an hour to answer, right? We must be concise with the questions we're asking so that we can kind of time limit the questionnaire completion time. On the other end of things, stakeholders don't want to read 100 pages of a report for one small precise finding. You want to be able to report your findings very concisely and in a way that it is time efficient for stakeholders to read the report and get all the information they need. The last point is biases. Biases are going to exist in all forms of data collection, regardless of what you do. It doesn't matter how many checks and balances you put into place, there's always one bias that will rear its ugly head during the process. The only thing you can do is your best to recognize and then limit the biases as best as possible. All right, and that brings week 4 to a close. So just a couple things to highlight. That PDSA cycle, something really important, not necessarily something that's complicated, but something that you'll find yourself going back to over and over again in the profession of quality and performance management. And then customer service as a whole, as I'm sure you're well aware of, very important aspect. A lot of things kind of collate onto customer service. It doesn't matter if you're working at a Tim Hortons or if you're working in any sort of healthcare environment. The customer is pretty much who has final say of if you're doing a good job or not, right? So with that being said, if you have any questions, whether it's about course content, the assignment, I would say the midterm, although we have a lot of time, so maybe hold off on that until you get a little closer. Shoot me a message through Canvas, and we'll make sure that everything gets ironed out. All right, until next week, bye.